We're delighted this evening to have all of you here for what is a very important topic in the public policy world right now. And for us, I think it's an event we wanted to put together for some time. Obviously, healthcare has been a huge topic since the 2018 provincial election, and there's a lot of different facets involved with healthcare, from primary care to obviously the Premier's talking about hallway healthcare, a lot of different aspects involved within the healthcare system, and it is evolving. And so we've been very pleased to partner with the Alzheimer Society to partner for this event, and I think today it'll be a really in-depth conversation. I don't think we'll cover everything. I think we'll be just scratching the surface, and based on our call we had earlier in the week, and I think it'll be the start of many conversations within the association about healthcare in Ontario. Without further ado, though, I do want to introduce MPP Robin Martin. She's a parliamentary assistant to the Minister of Health. She's also the MPP for Eglinton Lawrence. Robin's going to give some opening remarks to kind of set the stage for our panel discussion, and then from there, Kate Hellis from Enterprise Canada will moderate the conversation. So without further ado, please, I'd like to welcome Robin Martin to the stage.
So I'm just going to put this up here. Now, don't let any pictures get out. But apparently, I am Minister of Health. Don't tell Christine. I'm keeping this. Anyway, good evening, everybody, and thank you very much for the introduction. And it's really a pleasure for me to be here with you tonight. I used to work in a law firm, a couple of law firms down here downtown in my former life, so it feels nice to come back. This is a very nice office. You would be happy to work here, I'm sure. Personally, and maybe this is like many of you, I've had the experience of caring for an aging parent with dementia. And of course, as the MPP and parliamentary assistant to Christine Elliott, the Minister of Health, I have heard many stories of other people who have had these similar experiences. And too often, these stories include sometimes the horror of finding that a loved one may have gone missing. So Ontario is helping families and caregivers and communities recognize the risks of dementia and be prepared for these incidents and better ensure that seniors can live safely in their communities. And about 125,000 seniors apparently living with dementia are at risk of wandering or going missing each year. And that's why the province, again, has stepped up to put seniors' safety first. And today, we made an announcement, and some of you may have already heard, that we're providing nearly $600,000 to the Alzheimer Society of Ontario to deliver a program called Finding Your Way. And this funding will go a long way to helping ensure that those seniors are kept safe, especially that we have within Ontario about 240,000 seniors who are living with dementia. So today's announcement is another example of how our government is trying to work to put seniors first and put their families first by making it easier to find their missing loved ones faster. And that's what the announcement today was about. It's a multicultural wandering prevention program that provides practical tools and advice for individuals, caregivers, and the community to recognize and reduce the risk of someone with dementia wandering off and going missing. And the program will also help to support quick, safe returns should an incident occur. So this new funding for 2019-20 will help to locate missing seniors living with dementia by working with the police and promote the Find Your Way program resources in communities. And by delivering seminars as well for individuals, caregivers, and others to educate them and promote awareness about these issues. So it's a kind of collaborative work that we want to see evolve as part of our government approach to solving our health system challenges. And our government is working hard to build a healthcare system that supports Ontarians living with complex health needs like dementia and ensures that they have the right healthcare services and facilities. We're committed to building a public healthcare system that allows seniors to enjoy the highest possible quality of life, staying at home where that's possible, because that's what most seniors would like to do. But for seniors who need long-term care, we're also committed to ensuring that they have a high quality of life and that the spaces are available when they need them. I think when we took office, there were 32,000 seniors on the wait list for long-term care. And this is part of our hallway healthcare problem, is many of them can't go home and they need somewhere that they can be taken care of, and those spaces don't exist. So we're working on that. We're also creating a comprehensive healthcare system that will address the needs of people living with dementia, their care partners, and their families. And it's part of an overall system that Minister Elliott has talked about many times, an integrated and sustainable public healthcare system, which will make it easier for our frontline healthcare providers to work together to provide Ontarians with the kind of healthcare which is high quality and collaborative, and which is the care that we think that they deserve. And you may have heard about our Ontario health teams, which are now in the first initial stages. We think they're critical to achieving this goal. The health teams will strengthen partnerships amongst healthcare providers to create a more seamless experience for patients. And we're hoping both to centralize in the sense of some of the back office functions. We don't need to have the back office functions replicated everywhere. And decentralize in a sense to let the decision-making happen at the local level to respond to the needs of the community through the Ontario health teams. We think they'll be foundational building blocks for our healthcare system and for ending hallway healthcare as well, by pushing resources out into the community from the hospitals. And we're going to try to give them incentives within the Ontario health teams locally to do them. Because it'll be in everybody's interest to keep people out of hospitals as long as possible. So our government is very proud of the incredible job that our frontline providers already do, and it's important that we make sure that they have the tools that they need to keep up the good work. Supporting partnerships between healthcare providers that ensure patients experience better transitions and more connected, easier to navigate services is part of what a 21st century healthcare system should look like. So we'll continue to engage with the health system partners, all of them, in addition to people with lived experience, to improve service delivery, reduce gaps, and create a system that is both flexible and responsive to individual patient needs. And of course, this includes the needs of Ontarians living with dementia or Alzheimer's and their caregivers and families. So I look forward, like I'm sure you all do, to hearing from the panel and what they have to say. Thank you.
Thank you, MPP Martin. We can actually frame that if you'd like. Get some duplicates up and maybe mail it to you out. So thank you, MPP Martin, for setting the stage for this timely and important discussion. The goal of building a more patient-centered healthcare system is one that I'm confident in saying we all share, and the government deserves credit for putting patients, care partners, and families at the heart of this transformation. My name is Colin Fitzgerald, and on behalf of the Alzheimer Society of Ontario, it is my pleasure to welcome everyone here tonight. I would like to thank once again MPP Murphy for joining us and for the greetings, the Public Affairs Association of Canada, and BLG for hosting us tonight. The mission of the Alzheimer Society is to alleviate the personal and social consequences of Alzheimer's disease and other dementias. We do this through a network of local Alzheimer societies active in communities across the province. Our team of social workers, PSWs, public education coordinators, and first-line navigators, and countless other dedicated professionals work to provide care to over 70,000 individuals each year. Dementia is, in many ways, a case study on the importance of having a coordinated, integrated healthcare system. On any given day, a person living with dementia might interact with their care partner, a social worker, a personal support worker, or first-line care navigator, staff in an adult day program, and their family physician. On the worst days, they might also interact with a triage nurse, an emergency room physician, and other hospital staff. All these moving parts in our healthcare system need to cooperate and collaborate seamlessly to provide the care Ontarians deserve and expect. Families are understandably exhausted of experiencing a healthcare system that at times seems like it doesn't share information, and it can place the burden for navigating the healthcare system on patients and their care partners. To help us understand how healthcare in Ontario is changing to meet the challenges of a complex population, it is my pleasure to introduce tonight's panelists. Starting from the left, Deborah Simon is the CEO of the Ontario Community Support Association. Her background includes work across the spectrum of healthcare, in acute care, long-term care, and the rehab sector. Deborah has worked with government as the nursing coordinator for the Ministry of Health and with planning bodies on the board of the District Health Council in the Durham region. Deborah is a registered nurse with a Bachelor of Arts from York University and an MBA from Athabasca University. Next to her is Heather Pessione. Heather is BLG's Toronto Office Research Partner. In her practice, Heather assists lawyers with litigation and related legal strategies, written advocacy, and conducted and directed research. She has particular expertise in appellate and public law advocacy, corporate governance, and in the health and energy sectors. Before becoming a lawyer, Heather studied bioethics, and her master's thesis focused on her main areas of interest: prenatal testing, genetic counseling, and disability rights. Next to her is Kathy Barrett. Kathy is the CEO for the Alzheimer Society of Ontario. Kathy leads with a strategic mindset to help the organization reach its full potential. Kathy drives innovation through fundraising and program development, and Kathy has worked in the not-for-profit sector from the start, beginning her career as a gerontological social worker. By the way, it took me about 15 tries to figure out how to say gerontological. That was the whole Uber ride here was repeating that. Again, as a recent Entrepreneur Fellowship graduate of the School for Social Entrepreneurs, Kathy tackles organizational challenges and change from the inside out. Using design thinking to drive success, Kathy believes we can change the culture of the not-for-profit sector. Beside Kathy is Parashka Bhatta. Parashka is a nursing professional with 28 years of burn trauma, critical care, and mental health experience, and sits on the board of the Registered Nurses Association of Ontario. Parashka studied nursing at Athabasca University and international executive business at the University of Toronto. She is currently studying for her Master's of Arts in Counseling Psychology at the Yorkville University. Parashka teaches nursing and quarterly projects at Seneca College, and she is dedicated to excellence in patient-centered care, evidence-based practice, best practice guidelines, and working collaboratively to create models for outstanding customer service with integrity, humanity, and dignity. Finally, Katie Gillis is our moderator for tonight's discussion. Katie is the health practice lead at Enterprise Canada, a leading strategic communications firm across the country. Katie holds a master's in international public policy and is a strong advocate for the mental health sector, having served as a lead policy advisor for Ontario's mental health strategy. Katie brings deep experience in the healthcare sector, and it is my pleasure to introduce Katie to get tonight's discussion started.
I think we're going to have a very interesting discussion today. I'm thrilled to be sharing the stage with such amazing healthcare leaders, and I love seeing an all-female panel, so I'm sure today we'll have a great discussion. I think we'll have a lot to talk about, so I think we're just going to jump right in. I don't think there's a more timely time to have a conversation about healthcare. There are many changes going on in Ontario's healthcare sector, which MPP Martin has given us a great introduction on. Whether it's Ontario Health Teams or the creation of Ontario Health, there's a lot happening in our healthcare space today. So much change, in fact, that it's been said that this is the biggest change in our healthcare system since the introduction of Medicare. So to set the stage, I'd like to ask our panelists to maybe put into perspective in your role. Can you explain what these changes mean for our system and for the organizations that you represent? And Deborah, as the CEO of Ontario Community Support Association, maybe we'll start with you.
First of all, I just want to thank Parents and Alzheimer's for the invitation to be here, and this will be a really interesting conversation. And nothing like dating yourself by talking about district health councils, because for those of you who are around will know that there's many iterations of transformation that have happened in this province since DHCs. So I guess I want to start by saying that this transition that we're engaged in, this transformation, with all due respect to how important it isn't really just the beginning. We've been on a long journey around transforming this health system for some time, but I am thoroughly excited about what the Ontario Health Teams will actually be able to do in terms of their efforts to streamline and right-size the system. I think what's been really exciting about what we've learned in the past, particularly with the work that's been done around health links is that we have learned as patients, and we coordinate as a healthcare system around their care plans, and we fully engage the system. That meaning our primary care physicians, our frontline clinicians across the system, that we could actually provide really top-notch healthcare to patients. So, why are we having to sort of start from scratch on this? Is that because we are such a complex system, we've actually complicated it for everybody by the myriad of specialties that we have as a system. But I think we're really excited, and I know that I'm hearing more and more from individuals, albeit the excitement around the change, that there's an opportunity now to talk to one another about some of those issues that we've had in terms of the way we've delivered services in the past, the fact that we haven't understood what each other has done in the system, and more importantly, really to surround those patients' clients with the care that they require. For our members and providers who are out there in the community, I think the opportunity to work directly with acute care, long-term care, and other parts of the system is a really exciting opportunity. For the most part, home and community really has spent a lot of time in the upstream world, that is trying to keep individuals and people home, healthy and safety, and not patients. So thus my deeming individuals who touch the system more as clients as opposed to patients, and that's kind of where we would like to see people. But that opportunity to be able to engage with the broader system and to really share what it is that they do in terms of keeping people home in the system is really important. I think, however, when we go through this change, we can start to localize who does the care and maybe some of how the care is done by Ontario Health Teams. But what we can't do is localize the what we do, and I think that's the important piece about what Robin had talked about around the ability to standardize and have data and to be able to provide a broader basket of services for individuals who need the care. Someone who's in Temiskaming does not want to know that the only way they can get, for instance, adult day services is to live in the GTA. So I mean, that's not a great example, but an example of what could happen if we get way too localized in terms of what we do. But certainly we have to reflect the communities that we are serving, and I think that will be an important part of what happens. With 70 potential teams across the province, I think that's going to be quite an interesting exercise, and I think people are really getting excited about what the opportunities are there, and we're in a what we call low rules, no rules environment, so that really allows for lots of blue sky. But when the dust settles, I think we're going to actually look at what are those services that every single OHT needs to have as part of the base services that they deliver, and we're certainly excited about the idea that home and community will be a big part of that. So I think over the last few years, I think partnerships have been strengthening. I know as an association, we're very much engaged with our other association partners, and doesn't opportunities like this really strengthen that ability to start to work together and start to deliberate on how we can do things better. So I'm really struck by how excited people are and how engaged they are. And at the end of the day, I think what we're really looking for is that just what Robin had talked about, the fact that we have a system that is actually integrated around patients, and that patients and people who use the system have a real say in how these services are delivered across the province.
Great, thanks, Deborah. And Kathy, as the CEO of the Alzheimer Society, I'm sure you have a lot of interesting insights both from the patients you hear and the caregivers you work with, but also I'm sure from the people who work in these societies across the province. Can you talk a bit about these changes from your perspective?
Yeah, absolutely. It's hard to go after such a beautiful answer as that. But I agree with everything that Deborah said, and certainly as a gerontological social worker from many years ago, the issues that we still see today in clients that we serve have been actually around since I was a frontline social worker. So when this announcement of transformation came out, we actually were in celebratory mode. It's a very good news story in that a system that is centered around patients and clients is good for everyone. Obviously, first and foremost, the clients that we serve, it's good for the healthcare system because as Deborah said, our job in the community service sector is actually to keep people out of that system as long as possible. And so for the Alzheimer Society, it's actually a good news story in another way, and that is we've been doing this work on the ground, frontline, in our local communities across the province for many, many years. And it's actually an opportunity for the community support sector to actually shine and to talk about the incredible work that we've done. We are experts already in the community sector at partnerships. That's how we get our work done. And to actually bring in acute care and the more medical side of the system into those discussions is really great news. And I think focusing on the patient and keeping them as healthy as possible, and also aging, in particular the clients that we work with, in a place that they want to at home with as minimal intervention as possible is good for everyone. So it's a very good news story, and I think, as you mentioned, when the dust settles and all the partners are at the table and we can actually see what everyone is doing and really learn from that, I think is going to be a really great thing. I also think it's either by design brilliant or maybe by accident brilliant, but actually having very few rules associated with how these teams are being developed, it just invites innovation and invites people to really step forward. And maybe some, particularly with community services, maybe some players that would not have been able to step forward before can really take the leadership role and really come up with some really creative solutions that hopefully, once they're tested and actually roll out across the province, some really innovative ways to approach healthcare in the community.
Great. So you guys touched on a lot of great points, and it's clear there's a lot of excitement for these changes. And I do want to come back to that, but first I think I want to get to the hard stuff. Change is hard. Transforming a system, as you pointed out, that's so complex, is hard. So there's certainly going to be hurdles we're going to need to overcome, barriers we're going to need to overcome. So I think I want to talk a bit how we're going to do that and also what that means for patients. But even before we do that, I think we need to talk about how we got here. You guys started to talk about the patient experience or the client experience in your case. And can you talk a bit about, from your experiences, whether as a practitioner or as a system leader or even as a patient or a caregiver for someone, can you talk a bit about the challenges that we're seeing in today's healthcare system